The hardest thing I've ever had to watch is the look on a daughter's face when she realizes she can no longer provide the care a parent deserves. Welcome to part 2 of our series, Your Retirement Fund Might Not Be Enough. I'm Dr. Hanz. I've spent years in hospital wards and nursing homes. Today, we'll talk about the reality of aging and caregiving for women.
So unfortunately, I have the privilege of being with patients, when they're sick, when they're in pain, when they have cancer, when they have a heart attack and those things. But also one of the saddest things that I witness is when there's family members there and they say, "Oh, Mom, we love you. We really want to care for you, but it's really time for you to go to the nursing home." I'm just listening to the conversation most times and I think of my mom. So most of the people that I see in the nursing home are women, as I said. And some of them were really high-strung. They work for Apple, for IBM. Some of them actually own their own companies. But looking at them, it's kind of disheartening because, suddenly they need a lot of help. They need help feeding themselves, clothing, bathing, transferring, those ADLs that we always talk about. And I know it's probably harder for the kids to see their mom that way. It's also hard for the mom to be in that situation. So as a provider, as a physician, I feel the pain. I feel the pain, the loss, the regret sometimes. As we talked about, longevity has consequences. You live a long life, you get to age. So average is 80. So men live until 75 and women live until 80. So most of my patients that I see are women, and most of them, a lot of them, their friends have died already. They don't have family members. So why do women live longer? So do you have any ideas? So mainly it's hormonal. We know that estrogen is very protective for heart disease and stroke. And in general, women are more cautious about their health, right? They eat better, they don't smoke, most of them don't drink. And that depends on what kind of husband they. Sometimes the husband drives the wife to drink, and all bets are off. And also, they have better social networks. So in this regard, there's really some value on those people who are marites. So they talk about, at least they're aware of what's happening in their neighborhood. Marites is gossip in the Philippines. Chismosa in chismis. Yeah, chismis in Spanish, right? So they gossip, they're into other people's business, but in a way it's healthy. Yeah, because they keep up with the neighbors and see what's going on with the neighbors. And as I said, they have greater health awareness and they often seek medical advice. And usually my experience is that they're the ones who are pushing their husbands to see the doctor, right? This chart explains our main topic for today, why women are more impacted by long-term care. And as you can see here, 7 out of 10 residents in the nursing home are women. So if you're a male in the nursing home, you're a catch. So everybody's... So if before your nursing home life, you were not a catch, in your nursing home life, for sure you'll be a good catch. Usually, I don't know if it's true in the other cultures, but in the Philippines, if you're the daughter or the granddaughter or a female relative, it falls onto you to take care of everybody, right? I don't know who set that rule. Everybody knows? It's said that automatically you're the caregiver for some reason. I don't know why women agree to that role, but I guess because women are very loving and caring, right, by nature. But unfortunately, by default, women are left to care for the sick and the elderly. And the sad fact is that 2 in 3 of those family caregivers are women, and they're twice as likely to get unpaid care. So you provide all this care to your family member. In the meantime, you have to put your career on hold, right? If you have a business, you have to juggle between a business, taking care of the kids, taking care of your mom, and your brother is just out there, drinking, right? So, yeah, I'm really impressed by daughters. They have the most number of questions. They're very inquisitive, and they're very detail-oriented. So what we can say is, when you go to that level in your life that you need care, your life changes, but it doesn't have to be bad. It's just a life stage. And it depends on, as I said, the level of preparation you have. And it actually changes the lives of those who actually receive the care and those who actually give the care. For those who receive the care, all of a sudden you're in the nursing home, you have to ask for permission to do things, you have to take your medications daily and everything. You have to live by certain rules, right? And then for those giving the care, you have to juggle between family responsibilities and responsibilities with your loved one.
It's a heavy reality to face that most of the care is held together by daughters and granddaughters, often unpaid and overwhelmed. But knowing the problem is only half the battle. In our final part, we're going to debunk the biggest myths about Medicare and give you a blueprint to protect your family's dignity. Stay tuned for part 3.